Prime Minister Boris Johnson has been transferred to the intensive care unit after testing positive for coronavirus and heading into the hospital. CNN's Bianca Nobilo joins me now with the details on this. Bianca, what are you learning here?
Well, Kate, this hour we have learned that Boris Johnson's been transferred to the ICU. Now, we knew that he had been admitted to hospital about 24 hours ago. The Prime Minister tested positive for coronavirus 10 days ago. He'd then been in self-isolation. We'd barely seen him. He'd only emerged once or twice. Then, yesterday, on the advice of his doctor, because his symptoms were persisting, he was advised to go to hospital for, quote, routine tests. We were not told what those were. We then received word about 15 minutes ago that he'd been moved to the intensive care unit about 7 p.m., so about an hour ago local time. Now, that's all we have at the moment about the Prime Minister's condition. There was a lot of concern today when his de facto deputy, Dominic Raab, took the stage to do the press conference from Downing Street. We weren't getting almost any information about the Prime Minister's condition. No indication of deterioration, but the language had changed. Last week, they'd referred to the Prime Minister's symptoms as mild. Today, they were calling them persistent. Clearly, there has been a deterioration. On doctor's advice at St Thomas's Hospital in London, he's been moved to the intensive care unit. So as soon as we get more information about that, we'll update you. All that we have is that the PM is receiving excellent care from the NHS. There were posts on his Twitter account and his Instagram account today, but we haven't seen the Prime Minister for some time. The decision was made by the Prime Minister's medical team because his condition has worsened over the course of the afternoon today. Now, at the lobby briefing, which happens daily about the Prime Minister and the activities of the UK government, it was the notion that he was on a ventilator at that point was dispensed with. There had been some erroneous Russian reports that the Prime Minister was on a ventilator. The spokesperson took the opportunity to say, no, that's disinformation. That is not true. Then, as we now know, his condition has worsened over the afternoon. So the Prime Minister now in intensive care for his persistent coronavirus symptoms, which we now understand to have worsened considerably today, Kate.
And Bianca, I mean, to this point, correct me if I'm wrong, everything that we've heard is that he has been working from the hospital, completely engaged, involved. Look, if someone's telling me that someone here in the States has been put into the ICU, they're no longer really working from the hospital. Are you hearing anything about that?
Yes, so we now understand that Dominic Raab, who is the Foreign Secretary and also the first Secretary of State here in the United Kingdom, is going to deputise for the Prime Minister. Now, in the UK, we don't have the same kind of chain of succession, if you like, as you do in the United States. There's nothing formalised. If there's no Deputy Prime Minister, then it tends to be the first Secretary of State. So Dominic Raab, the Foreign Secretary, will be deputising. He led the Prime Minister's coronavirus war cabinet this morning at 9:15. But as you mentioned, today we were told that the Prime Minister was continuing to lead the country, continuing to be at the helm and work from his hospital bed. He was having all of his integral papers and all of his updates delivered to him there. Now, when our chief medical officer was asked in the press conference inside Downing Street today whether or not it was sensible for somebody who has been suffering from persistent coronavirus symptoms for 10 days of a fever and a cough to keep working from hospital, he said it depends on the individual. But that was reiterated by the Foreign Secretary that the Prime Minister was fully in charge and getting involved where he needs to. So that was the case at 5 p.m. local time this afternoon. So just 3 hours ago, and things have clearly deteriorated markedly since then as the Prime Minister has now decided to stand aside for the moment and give that responsibility. The responsibility to lead this country through this national emergency now goes to Dominic Raab, the Foreign Secretary.
Look, and Bianca, this isn't just any regular citizen. I mean, this is the Prime Minister of the United Kingdom. Have you received a clear answer? You mentioned the question of being put on a ventilator. Have you received a definitive answer if he is now on a ventilator?
No, we haven't, and obviously it's not my place, and I'm not a medical expert to speculate on the kind of medical condition that he would be. And we do understand, though, that patients who are suffering from coronavirus, if moved to the intensive care unit, are often needing a lot of oxygen support and perhaps ventilation. But we certainly don't know that for sure. All that we can say is that the Prime Minister's condition has deteriorated. Obviously, we would expect an update on his condition as soon as they have something, and that has been Downing Street's line this entire time. They have said, we will update you when there is something to say. Otherwise, stop asking questions. Essentially, the Prime Minister clearly has a lot to get on with, and he has his own responsibility to heal. So the Prime Minister receiving care at the moment in the intensive care unit, now Dominic Raab taking over. It was curious, actually, in the press conference today, Kate, it was noted by several journalists that the Prime Minister had been underscoring how precious the NHS was and how precious each of these beds in hospital is right now as Britain nears the peak of this outbreak. 493 people died, 439 people dying today. One of the journalists asked the question, well, which is it? Is the Prime Minister fit and well enough to lead the country at this point? Or is he so sick that he requires one of those precious beds that so many people need at the moment in the United Kingdom? So I think that kind of question, which was struggled to be answered by those at the press conference, certainly started people asking that question. You know, which one is it? Boris Johnson is somebody who always goes out of his way to project, you know, a vibrance, a strong leadership. He's exuberant, and he also doesn't like to divulge personal details. But clearly, the health of the Prime Minister now is absolutely integral to the health of the nation. So that's why people were asking questions this afternoon, trying to discern, is he well enough to be making decisions not just on a daily basis, Kate, that pertain to this country's health and ability to withstand this outbreak, but on an hourly basis. Clearly now he has given those responsibilities to his de facto deputy, Dominic Raab, who will be taking those key decisions in the coming hours and days.
No, and I think you pose, and other journalists are posing the paramount question right now. If the Prime Minister is well enough to be leading the country at this point, really sad turn of events right now. As soon as you have updates, please bring it to us, Bianca. I really appreciate it. Thank you so much. Joining me right now, CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, thank you so much for jumping on so quickly. Clearly a lot not known, but as we were learning what we heard right there from Bianca, we know, it sounds like we know one thing essentially, that he clearly has worsened because he has now been moved into intensive care. What are your questions that you have now for the limited information that has been made public about the Prime Minister?
Well, you know, he was admitted to the hospital last night, is my understanding, about 10 days after he was first diagnosed. What we heard last night was that it was for more routine sort of, evaluation in the hospitals for some testing and things like that. I want to know, just what was his status at that time last night, and then, obviously the question, Kate, is what happened today that sort of prompted this move to the intensive care unit. It's usually one of a few things. The most obvious thing, especially with something that is a respiratory problem, well, there was concern about his ability, Boris Johnson's ability to sort of continue on his own without some additional oxygen, maybe even a breathing machine. Don't know that for sure, obviously, but that's one of the reasons people go to the intensive care unit. Right. Sometimes it can be due to heart issues. If someone's unable to maintain their blood pressure for some reason, they need to have medications placed that are typically monitored and administered in an intensive care unit. It could just be sometimes out of an abundance of caution. Look, we can't monitor someone as closely as we would like on a general care floor, need to go to the intensive care unit, or it's some sort of a more sophisticated therapy, some sort of treatment. Of course, as you know, Kate, there is no specific known approved therapy for COVID, but sometimes if there's certain medicines that they want to try, sometimes they will do that in the intensive care unit. But to your point, something clearly changed. What was happening as of last night to today is a very different sort of story. So my guess is it probably has something to do with his heart or his lungs, and we don't have that information right now.
Look, and I remember Governor Cuomo actually saying last week, at the end of last week, in terms of how they talk about resources here in New York, he said he basically classified an ICU bed in his mind is any bed that requires a ventilator. And I found that interesting. And I do wonder, though, if we're told that Boris Johnson was not on a ventilator before, if he is now, what does that indicate?
You know, first of all, you know, being 10, 11 days out from his initial diagnosis, this is the pattern, you know, as we've really looked at this data, this is a pattern that we've seen over and over again, that somebody may have a sudden, sort of somewhat abrupt decline in their ability to just maintain their breathing on their own, and they need to have mechanical support. I think you're right. I think what you're driving at, Kate, is right, is like in a midst of a pandemic, if someone is going to the intensive care unit, it obviously has to be for good reason, because these are obviously a very precious commodity, and the number one reason right now is because of ventilators. And it's not just ventilators, but it's the respiratory therapists that actually administer all that therapy and are taking care of the ventilator and the patient, and all the monitoring and all that goes on. You need not hour by hour monitoring, you need minute by minute monitoring now. Yeah. So all of that is the case. Now it may be that they're worried enough about him that they think that he may need one, so he's sort of in that phase in between, and they thought it'd be better for him to be in the intensive care unit, just as a caution, but a very concerned caution in the sense.
How is the Prime Minister? Obviously a lot of concern overnight that he had to go to hospital.
Well, I've heard that he's doing well. It's worth just re-emphasising that this was a precautionary step on the advice of his doctor. He'd had persistent symptoms for 10 days after testing positive for the virus. And so he took advice, and his doctor said that it was best to go into hospital for some routine tests. It wasn't an emergency admission. It was a planned one. Obviously, he's in hospital now having the tests, and we all hope that he's fit and well and back in number 10 as soon as possible.
Well, we certainly do, and it's really brought home, I think, the Prime Minister himself going through this. We know that his fiancée, Carrie Simons, also has had coronavirus symptoms, hasn't had a test, but believes she's had a week in bed. She's pregnant, obviously very concerning for them as a couple, and please send both of them, if you get the chance, our very best wishes for a full and speedy recovery. Having said all that, there's obviously a professional situation here where he is the Prime Minister and he is leading the war against the coronavirus. Are there concerns that the best thing to do, given that he's now been hospitalised, might be to let Boris Johnson have the time to properly recover rather than trying to work his way through this?
Well, he has worked phenomenally hard. He's been in charge of the government, holding meetings remotely, which has not been as difficult as it might seem, because we're all working from home now and holding meetings, including the cabinet, from using video conferencing. But today he'll be in hospital having the tests. As I say, I back to number 10 as soon as possible. Whilst he's in hospital, he'll continue to be updated about what's going on. He'll be in touch with our fellow cabinet ministers like myself. And in his absence in hospital, Dominic Raab will chair the meeting this morning in a few moments' time, which is the morning COVID-19 committee that discusses the steps that need to be taken today. So that work is very much continuing with the team at number 10, with other cabinet ministers. But the Prime Minister wants to keep on leading the effort, and I hope that he's back leading from the front as quickly as possible.
Can I ask about what action might be taken today? We saw over the weekend a lot of criticism of a minority of people who were not maintaining social distancing on commons and in parks. Close to me, Brockwell Park had to be closed yesterday because there were too many people there. And Matt Hancock, the Health Secretary, was asked about this and said that if a minority of people continue to spoil it for the majority, he might have to take extra measures to restrict our daily exercise, which is clearly not sunbathing, for instance. The vast majority of people are respecting the rules and will be extremely concerned about the closure of open spaces and potentially restricting exercise. Is that something that you are seriously considering? And do you endorse the closure of green spaces?
Don't imminent plans to increase the restrictions or to ask councils to close parks and open spaces. I don't want to do that. I think it's extremely important that we can all get out in accordance with the guidelines and have some fresh air and do some exercise. Obviously, we need to be responsible and to follow the advice, which is to do that once a day, to do it with our household or on our own, and to go for a walk or a jog, not to congregate or have picnics or barbecues or anything like that. But of course, many people, millions of people, live in flats, don't have the luxury of gardens, need that open space to close parks. I've spoken to a number of councils over the weekend who have either done so or come close to doing so, and asked them to use their powers very judiciously, only to consider doing that in the most extreme circumstances where they feel that there's just too many people in the park and they can't enforce social distancing rules. That might occur occasionally, but it shouldn't be routine. And I would just urge that minority of people who are doing those things, don't spoil this for the rest of us. Don't for those people who are in flats, the families who really need to get out and enjoy this for all the health and the mental health benefits that come with that.
Can I ask you, Mr. Jenrick, I mean, listen, there are morons out there just continuing to ignore this, how they can look at the news coverage with the death toll in this country and continue to ignore the very simple, basic rules is completely unfathomable to me. How they can listen to NHS staff talking about the horrors of their daily work now, trying to save our lives, it's staggering to me. And I just hope that they listen to the message and act accordingly. Can I ask you about something else that's causing a lot of controversy? Wealthy football clubs owned by billionaires like Liverpool, Newcastle, Tottenham, all owned by billionaires, all furloughing their staff whilst continuing to pay their star players gazillions. Why is this being allowed to happen?
Well, I think that does seem a very uncomfortable position, doesn't it, where the taxpayer, working people in this country are paying for staff to be furloughed, those staff who are on low wages, but yet some of the highest paid employees, some of the players in those clubs have not yet managed to agree to take a pay cut, and some of the owners, as you say, who are extremely wealthy, aren't playing their part. No one wants to see this kind of goodness. People want the country to come together, and for business owners and very wealthy individuals like some of those footballers to play their part. The Health Secretary said the other day that he thought it was absolutely right that wealthy players agreed to take a pay cut, and I think that just needs to happen now. Obviously, we don't want to do something that hurts those players who are on lower incomes, because not every footballer earns a fortune, and so we need to ensure that players who are on lower and middle incomes are protected.
I have a problem with what the Health Secretary's been doing in relation to repeatedly targeting the players who, to my certain knowledge in many cases, are either ongoing contributors to a number of charities or intend to make significant contributions now anyway, regardless of anything else. Why is the Health Secretary trying to, in a way, put a stigma around footballers when the real issue, it seems to me, are the billionaire owners, not the players, who are furloughing staff, not dipping into their own massive pockets? It's not the players that are making that decision. And yeah, they're an easy target and they get whacked in all the headlines. But I don't understand why the government keeps targeting the players and not the people, the real organ grinders.
Well, I think that's a fair point. What I think the Health Secretary was saying was that everybody needs to play their part. The players have a role to play, but so do business owners. And we shouldn't be, making use of these schemes if you're a business that's got all of the resources to get through this crisis. We need to be, very careful when we deploy these schemes. These schemes are designed to help keep people, in work, to maintain the connection between an employer and an employee, so that when we're out of this crisis, businesses can start up again and we don't have very large numbers of people unnecessarily unemployed with all of the damage to the economy and people's lives that come with that. But if you are a business owner, you need to consider carefully whether you should be taking advantage of those schemes, because obviously they're costly to the taxpayer and they limit our ability to do other things and protect other people and groups in society.